What the grand-aides program does is leverage physicians and nurses so they can see sick people quicker and keep people who don't need to be in the emergency room at home. So a grand-aide is a certified nurse aide who's had training, who has the characteristics of a good grandparent. 6 grand-aides can work with 1 nurse, leveraging that nurse 6 to 1. Several years ago, a very prominent family physician said to me, you know, about 50% of my patients could be taken care of by a good grandparent. Now that's hyperbolic, but it made a pretty important impression on me. A grand-aide is someone who's nurturing, someone who's caring, someone who's competent, someone who doesn't fall apart when somebody's sick, and that person becomes a connector between the patient and family and the care team. Grand-aide goes home the day or the day after discharge with a patient with a disease such as heart failure. Turns out in heart failure, as much as 50% of the 30-day readmissions are in the first week. So the grand-aide visits every day for the first week. So very early on in the experience at the University of Virginia, there was a patient who the grand-aide went to see. Grand-aide goes through the protocol, and the patient is pale, sweaty, feeling bad. And the grand-aide takes their handheld device and uses the video, HIPAA compliant, back to the supervisor. Supervisor says, no, you don't look so good. Let's go do your medication reconciliation. Grand-aide starts up the video from the handheld device, puts all of the medication that the patient is supposed to be taking, coming home, at one point on the table. And they check off one by one, that's fine. Then the grand-aide gets everything else out of the medicine cabinet, puts that on the other side of the table, and says, you're not taking any of this, are you? And he said, well, of course I am. Aha. There was the problem. The grand-aide and the supervisor were able to say, you know what? Take only what you were supposed to take. By the time the grand-aide got back the next day, the patient felt a whole lot better. A nurse can do that. The problem is that's very expensive and you may not be able to find the nurses. A grand-aide can absolutely do this at a reduced cost. The patient gets helped in a number of ways. They get taken care of at home, they get taken care of efficiently, but they still have absolute access to the medical care team. Now the other people that are helped are the practitioners. The nurses, the doctors, in the clinics, in the emergency rooms, in the hospitals. 6 grand-aides report to 1 nurse, so the nurse is leveraged and the grand-aides are much less expensive than a nurse. I'm Tim Garson, and I believe that policy innovation can improve health.